Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
And today we're joined by Joel Aguilar, who shares his journey of getting diagnosed with psoriatic arthritis. Joel's a veteran and he describes, getting discharged with pain and just spending a lot of time in pain looking for answers to finally getting diagnosed, to then getting comfortable with the treatment options and how he's incorporated exercise in his life. We also talk a lot about navigating the Veterans Health Administration benefits, and he has some really good advice for people, so I'm excited for everyone to have a listen.
Excellent. Let's get into it.
Hi, Joel. Welcome to the Health Advocates. We're so excited to have you here today. Can you begin by introducing yourself to our listeners?
Yeah, my name is Joel Aguilar, and I live in Alva, Florida.
And you were diagnosed with psoriatic arthritis, right? Can you tell us a little bit about your background and, what got you to first start noticing symptoms?
Yeah, it was a long process. Started when I was about 20 years old. I was in the Navy. I was in San Diego, and I was really into working out. I noticed my right bicep tendon started aching. Ended up, after months, getting a diagnosis of bicep tendonitis. Did rehab with that, all kinds of different things. Took a lot of ibuprofen. Over the next 3 years, I had a series of different responses in my body. I had other pains, other swelling, joints, neck, hips, feet, all kinds of problems. Ended up in Japan by 1992. At that point, they exhausted all their research on me and just basically said I was unfit to serve anymore because I couldn't wear their shoes. I had really bad plantar fasciitis. My feet were swollen. I couldn't get in normal shoes. I then was medically separated. Over the next probably about 20 years, I self-paid for many different avenues that I sought myself. I would, usually after a month or two with a certain doctor, I would get worn out and say, screw it. And I would just be on to the next thing. Sometimes I would get injections. I was diagnosed with all different types of things. I was tested for many things like Lyme's disease, different autoimmune things. Nothing was coming up. Again, I would just wear out, just take ibuprofen, get some shots, and move on my way just painfully. It was around 15 years ago, I ended up showing up to the office of a rheumatologist who within minutes said, I know what you have. And I'm like, yeah, whatever. Nobody's ever been confident. In fact, nobody's even had an idea what I had. She just said, you have psoriatic arthritis. And I said, well, how do you know that? And she goes, look at this pamphlet, look at all the symptoms. At that point, that day, I had my toes and fingers were really swollen. And I had some other swelling in my neck, I think it was. I can't remember exactly. I was thrilled, but also very skeptical. She said there's a couple of courses I could do. One was oral medications, and she said injections would for sure do it. I was not ready to commit to injections at that point. I was trying to stay as natural as possible, and I'd done dietary changes to try to facilitate that previously. About a few months later, and I can't remember exactly how long, it wasn't working at all. I just asked her, okay, can I try it out? She had some trial injections. She gave me one in the office. I remember very well that day. It was afternoon. Within a couple of hours, it was like 2 to 3 hours, my swelling in my fingers and hands was completely gone. I just absolutely could not believe the response I had. And I've never been off of it since. I had to self-pay for a while. My insurance would not cover it for maybe the first year. And then I ended up finding out I was eligible for VA benefits, full benefits. The veterans, VA's now covered it for probably a decade. And it's been life-saving. I simply not the same.
That's awesome. I'm so glad to hear you say it's life-saving and that after all those years of searching for answers, you not only got an answer, but a treatment that works. It's really unbelievable, which just makes me want to ask, during those years that you were going to every doctor and, getting these injections or testing done, what was keeping you motivated to keep looking for answers?
It was cyclical, and I'm as normal as anybody else, where you'll get motivated when you're in pain and you can't do anything. And I had, if I build up enough money or found somebody that would do something for cheap, I would try them out. And eventually, with no success, I would get unmotivated and with that effort and go back to resign to, I'm going to have a life of pain and swelling and discomfort, and I'll be limited. So it's just a cycle of that. And anywhere from 6 months to a yearly basis, I would try something else.
And then what was that moment like for you? You mentioned you were diagnosed within 2 minutes and couldn't believe that someone finally had an answer for you. What was going through your head at that time, if you can remember?
Well, I remember that I hoped she was right, but I didn't believe that she was right. When I believed she was right was that Friday, probably around 5 or 6 in the afternoon, when my swelling went down, and it was unbelievable.
And I'm sure there's a lot of people out there that, like you, have hesitation to start on a medication. Like injections feel like a lot, especially injections you have to do yourself. Like when you live with chronic illness, you kind of get used to that. But at first, that feels like a really not normal thing. What, I guess, advice would you have for other people that are feeling similarly hesitant to start on an injection like you were in the beginning?
My advice is follow your instinct. I did, and my pain level and the time involved, I just did the math. If it had been a new onset thing, I probably would have stubbornly rejected it. But after that long, I was kind of worn out, and I just had to make a change. And even at some risk, even if it was unknown, I was willing to do that.
And do you remember anything that your doctor said or anything that you asked to help feel more comfortable? Or was it really just like, I'm feeling so uncomfortable, I got to just try something?
I kind of thought that since it had been out a little while, I think a few years, and I was kind of trusting the FDA, they'd done their research, that I was doing, I think, the risk assessment, which is that the risk reward was likely in my favor. That was my math.
Yeah, I think that's great advice. Think about your own personal risks and benefits and what feels good for you. I wanted to transition a little bit to talk about your fitness journey. And the first time we met, you talked a lot about how fitness is really important to your psoriatic arthritis journey. Can you tell us a little bit more about that and how you stay active?
I was very active prior to that, and throughout my 20s, my fitness declined quite a bit. After that, I've been able to ramp up significantly to the point where just a few years ago, running in Colorado, where I had lived for 25 years, I was doing back-to-back weekends of 30-mile plus mountain runs. In fact, one day I did a Tough Mudder 10K, followed up by a 32-mile run, solo, unsupported. With plantar fasciitis, running was never going to be an option. I'd played soccer in high school, and that was out of the question up until then. And now I don't take it for granted at all. I work out 5 to 6 days a week, usually run 2 to 3. And what's helped me, I do have some off days still. It's not often, but heat is my friend. Staying warm. When I get stiff and it's cold out, I just move my body. It helps. I'm usually pretty active. I don't sit down and watch TV. I just go. And that seems to be also a big help as well.
It's so interesting because it almost feels like counterintuitive, right? Like your body hurts and you're like, I kind of just ache and want to rest. But in reality, with arthritis, getting those joints moving is something that really helps. So what do you have to say to kind of getting over that mental hurdle and getting yourself started with working out?
That's a good point, because you don't feel like it for sure when you get out of bed. You're stiff and cold, and you step down, the first steps are your feet are swollen and everything hurts and all that. But it's I think of it like a car motor. It always works when it's hot. It stinks when it starts cold, but if you can get it warm, you're going to be in good shape. But you got to get there, and sometimes you just got to be stubborn and just start moving, and then everything starts working. Instead of going with what you feel like, you know what you should be doing, and just do it.
And do you have a routine that helps keep you, I guess, focused or on the path to working out?
My memory of how I used to be in all the years that I couldn't do it, I'm still trying to catch up.
Yeah, for sure.
I'm just grateful. That's the bottom line.
Yeah, how, I guess, going into that feeling of grateful, can you tell us a little bit more about that? How has your life just turned around from working on your fitness and taking this treatment? What are you able to now do that you weren't before?
Just about everything and more than somebody my age could do. My only real limitations are my hand strength. Went away. I still haven't been able to develop it, and I'm almost really not willing to risk trying to increase it, because my joints, there's still, even though the pain is resolved and the swelling is resolved, I think think I still have some underlying issues I have to acknowledge and be just mindful of. But my real fitness level is higher, I think probably quite a bit higher than anybody my age. And my focus daily is just about doing the most I can. Helps a little bit. I have 15-month-old twin girls that they want to move, they want to do something, I have to do it. Changing diapers is a lot of dexterity, picking them up. They're both around 30 pounds. That's a lot of work. And I still have 6+ acres of a ranch to work on daily, and I'm the only groundskeeper. So there's a lot to do.
Yeah, I think that's great advice too, just like finding the movement in everyday life too. Like sometimes it doesn't have to be a big workout. It can just be like you're saying, picking up your kids or working on your lawn. Like it can be even, I know patients sometimes say, my goal today is to walk to the mailbox and get the mail. And that could happen on a slower day, but really like finding activities around the house can be a great way to get started into fitness.
That's right, because I do believe we lose a lot, even with normal people that have no conditions. Lack of activity leads to a quick decline. So I think with people that have these autoimmune type things that are like, especially with the arthritis component, you have a lot of excuses to not move because it hurts. I think you've got to do something extraordinary just to be normal at that point. And it's just, you have to be stubborn and have a strong will and then just do it every day.
Exactly. It's that self-advocacy that's so important. I want to go back to something you touched on earlier, how in the beginning of your journey, you were like paying a lot out of pocket and weren't really taking advantage of the full health insurance benefits that you had through the VA. Can you talk about when you discovered those benefits and how that's impacted your journey?
I've been self-employed for most of 30 years, so I had my own health insurance coverage. And of course, there was some limitations to that. And I ran into someone in my little town in Colorado that happened to be the person that enrolled people in the VA medical system. And somehow my history came up and he said, well, why haven't you been enrolled? And I said, I haven't talked to anybody about this since I left in 1993, so I have no clue what my rights are to any kind of compensation or benefits. So he helped me out, and lo and behold, I have 100% coverage. And at that point, even being in a remote town in Colorado, my main hospital was in Albuquerque, which then obviously limited my ability to go see people. So I didn't really take full advantage of it for a few years. But once I figured out the system, it's been amazing, especially the last probably 8 years has improved a lot. And there's programs for people that live remotely now. Community Cares allows you to access your own private doctors through the VA system if they can't service you quickly. So there's no long waits anymore. A lot of times can pick your facility, your own doctor, and the VA will pay for it if they can't service you quickly and to your satisfaction. It's two things. It's really good right now.
That's so cool. And yeah, I learned about this in our first conversation, right? You said if it's more than 30 minutes away from you, the nearest VA facility, you can choose into like a private provider closer, right?
Yeah, it's something like that. It's a mileage and also a time if they can't service you within, I think it's like 20 days and it's too far away, which is, I think, 30 miles or something like that. I've only ran into it about half the time where the VA can't service me with either one, the proximity or the time period. At that point, it's immediately offered. Would you like to find your own doctor? Let us know which ones you'd like to see. If they're in our network, you can freely see them, and most of them are. It's been pretty easy.
That's amazing. I mean, yeah, that makes such a difference. Like when you're in pain, the last thing you want to do is go far or wait a long time. It's so important to have these options. I'm wondering, you mentioned that your friend was the one that said, hey, check out the VA benefits. Like, how can others get started? Let's say other people don't have that friend that's like nudging them to get it and they've, done service. How can other people look up these benefits and get started?
The best way, I think, would just be go online and look up a VA. There'll be a 800 number and you likely will get a quick response and some direction. They're very responsive. And typically when you go on any of their sites, they can direct you right where you need to go pretty easily.
Amazing. Thank you. Yeah, I think there's such a misconception. At least like I haven't been in military service ever, but I've heard from others that the VA can be slow and long wait times, etc. And it's so, I don't know, just like eye-opening and encouraging to hear from you about the experience that you've had. And you've said it's really turned around in the last 8 years. So I think that, I asked you that question about how can others get started to say to others listening that even if you think you've heard it's long wait times, like call and find out out and just try and make that appointment, because like Joel, you're saying you just tried and now you all of a sudden you have all these great benefits, and it's such an important note of advocacy in your journey to say like, I'm not going to give up and I'm going to keep, fighting for the healthcare I need.
Absolutely. Well, I encourage anybody to inquire about that if you've done your service.
And, finally, before I let you go, what advice do you have to give to veterans or others with chronic illnesses who are kind of like struggling to get a diagnosis or access to care? Like thinking back to those early days when you were just going around from appointment to appointment, like people are in that situation now. What would you say to them?
I would say if you're as miserable as I was, don't give up. There's obviously different degrees, and unless you're in somebody's body and know the level of pain, discomfort, and misery, that's going to either motivate you to go do something or put you on the couch the rest of your life. And I hope everybody gets up and does something about it and find the person with the answer. There's going to be somebody with an answer.
I agree. There's someone with an answer. And in the meantime, there's people like us out there thinking of you, and just know that you're not alone in your journey.
Absolutely.
Well, thank you, Joel, so much for joining us on The Health Advocates and sharing your story with our listeners. And especially thank you for your service.
You're welcome, Zoe. Thank you for your time.
Wow, what a story. Thank you to Joel, and thank you, Zoe, for that great discussion. Joel's story of perseverance and self-advocacy is really inspiring. So thank you.
Absolutely. It really goes to show, it's never too late to get a diagnosis, to get on treatment, because it really can help. And you're not alone if, you're out there struggling in pain. Like, you have a community rooting for you.
Well, with that, we want to encourage everyone to check out all of our podcasts and hear other great stories like Joel's at ghlf.org/listen.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating, write a review, and hit that subscribe button wherever you listen. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.